roti untuk kita buat intervention pada psychiatric patients. And slide ni telah di-prepare oleh Dr. Pama. Saya present saja. Okay. Yeah. Okay. You cannot have a relationship without communication. So it's very important for every one of us to have a good relationship with your friends, with your peers, if you are married, with your wife, children. If you don't have good communication or without communication, you're going to not going to have a good relationship. An individual derives his greatest satisfaction in life through experience warm, positive, and meaningful communication with others. So, in mental health problems, when they have a broken family, your life will be not satisfied because you don't have warm, positive, and meaningful communication. So it will derail. Your life will be miserable if you don't have this experience. Because if you have a good communication, you will be feeling warm and positive. And there's a lot of studies say that if there is a lack of communication, will affect person's mental and physical health. So that's why we as MOT we have to really know about this social skill, right? Because one part of social skill is you need to have a good communication. So when talk about social inadequacy, you don't have adequate social in your life. The nature of social inadequacy is may be measured in behavioral terms. So people who having difficulty in or not having enough social interaction, they have a behavioral problem. And another thing, behavioral and learning theories. During your childhood, in these theories, they during your childhood, you need social interaction, social skill interaction, and whatever you experience, actually, your learning lifetime. So you need to not only doing it but also seeing it. So some of us, uh, all these psychiatric patients, they have a problem or haven't got experience in social learning throughout their life. They have a problem in their behavior communication because they not experience it. And the person, the cause that having social inadequacy is that a person lacking in social skill is one who has been deprived of adequate models of social behavior in his parents, siblings, peers, or other significant figures of influence. If you don't have, uh, if the person, especially our psychiatric patients, they lack of social skill because they don't have experience or the parents didn't have a good social development with the children. Eh? This is the cause of social inadequacy. Eh? And also, probably this is a genetic influence. Genetic means that probably your father, mother have problem in terms of social skill. Probably one of the cause of social inadequacy. So, when talk about social inadequacy, we know the characteristic of the individual. Right? It means that a socially inadequate person may be defined as being unable to produce desired effect on the behavior and feelings of other people that he wants and which society accept. eh. So we can see um, the characteristic of person because they not undergone the social upbringing, the social development. So if they didn't experience the normal or the norm of the society, eh, this is will be affected the person, the characteristic of the person. And this person, we can see the nature of or the characteristic of the person is appeared isolated, unassertive, bad-tempered, very cold, uh, cold figure, inept. Inept is you have showing no skill, no skill in socializing, and this person usually they they feel unrewarding. This the person when they isolate type of personality, unassertive, we can see that their achievement in life is not there. And this person also has difficulty in communicating with others, in forming and sustaining meaningful relationship. So they are unable to sustain their relationship because the the characteristic of the social inadequacy of the person. So this is the characteristic. So when they having a boyfriend or girlfriend, they not lasting long. Right? So they unable to joy with their life during during schooling, during working. They don't have mate, mate. They don't have buddy, don't have friends because they are unable to sustain a relationship, right? Because they have problem in socializing. So this is the characteristics of the persons who have social inadequacy. So what is the purpose of SST? Eh? So when the patient having a inadequacy of social, so we need to teach interpersonal skill that needed to relate effectively to other person. So we have to teach them interpersonal skill. So when they want to communicate with others, want to require or ask something, so we need to teach them. So in SST, when we train them, the SST emphasize the importance of setting clear expectation with specific instructions. So when we conduct SST, must be clear your expectation, uh, and also must be specific instruction because we want to develop their social skill. So coaching the individual through the use of frequent prompts. Sometimes we need to prompt, using prompt, frequent prompts, and then using modeling. eh. Some people, when they have problem of absorbing or receiving our instructions, sometimes we have to do modeling, especially children, child secretary, for example, hyperactive children. They are unable to follow instruction, but we can use modeling. Yeah. Engaging individual in role playing or behavioral rehearsal. So we do role play, eh, um, to engage them. So this is to come up with the positive behavior. That positive behavior involve social skills, and offering abundant positive feedback or reinforcement for small improvements in social behavior. So it's not easy to 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 train people who have this social skill problem, because social skill need being trained throughout their life experience, from childhood to teenage to adolescence. But we want to train them in our setting, in our clinical setting. That's why we need to have abundant positive feedback. We need to have abundant positive feedback to highlight that this is the skill that need to be need to be have for the individual. And if they able to achieve small improvement, we need to reinforce, because they have not been developed the social skill throughout their life. Okay? So when talk about social skill, is linked with mental health. Uh, they this person naturally, people who have inadvocacy of socializing, they fail to make eye contact, eye contact to you or the therapist, and then they have difficulty to respond to question asked to them, or they may say bizarre things. Bizarre thing is something that's strange, or unusual. And then during your session, you need to brainstorm them why these behaviors are important. Because they having a problem of realizing that this social skill needed. So in your activity of social skill, you need to do brainstorming why these behaviors are important. eh. So person who experience unease when engaged in conversation to the withdrawal of the chronic schizophrenic patient. So when you look at the schizophrenic patients, they're not easy. They feel uneasy, and uneasy if you have conversation with them. They like to withdraw in this social skill intervention. So it's not easy, because the nature of this person who have social skill problem, they want to withdraw with your conversations. And studies found that 7% suffers from serious difficulty with social behavior. And also, social inadequacy occurs in two patterns. When talk about social inadequacy, there is two patterns. Right? One is primary factors, and the other one is secondary factors. So what the difference between primary and secondary factors? Primary is something that may be primarily leading to rejection. Okay? and further social isolation, and in turn producing disturbed mental states. Yeah. So these considered as primary factors. So when they are unable to socialize, they not easy to engage with conversation, and they want to withdraw. This will be a primary leading to rejection. So if you not good in social skill with others, people tend to reject you. When people tend to reject you, you will further social isolate, and in turn produce disturbed mental state. So if you do you feel being if you experience isolation, your mind your mental will be disturbed. Yeah? It means that you feel lonely. You feel nobody care of you. Eh? So it will give disturbance in your mental states. So these are the primary factors. The secondary factors is that other kinds of mental disorder affect all areas of behavior, which in turn leads to rejection and social isolation, and add to the initial source of distress. So a lot of mental disorders affects behavior. For example, like schizophrenia. Right? Schizophrenia, for example, their negative symptoms. They have isolation behavior. Right? These secondary factors will affect more on rejection and social isolation. This will be uh, burden further burden them if they have this mental disorder. Yeah. So this is the one of the uh, factors that will distress them. Yeah. For example, like um, anxiety disorder, anxiety disorder, or phobia disorder. Right? This is the nature of the this mental disorder. There is a behavior of withdrawal, scared, seeing people, all that. This is the secondary factors that add distressing to the person, to the individual. So when you want to conduct SST, so the patients, the selection of patients must be one of the primary important things to do. Yeah. So based on the extent of their social inadequacy or the degree of subjective dissatisfaction with the performance of adult and social role that leads to an avoidance of those situations where an appropriate performance of these roles is obligation. So when you select patient, you need to understand what are their subjective dissatisfaction. It means that their performance, the performance of the adults. For example, um, you want to do intervention with patients who have social skill problem, you have to understand their performance. The performance, for example, they want to interact with others. They don't have any skill. What are the skill they lacking? they are lacking based on their role as an adult and the roles of the for them to the society. eh? And what are the situations that make them unable to perform eh, their roles? So you need to understand the degree and also the situation. For example, uh, schizophrenia patients. Uh, he is a Muslim, so one of their role as a Muslim to practice salat. If they the schizophrenic symptom have been treated. So you have to know what are their role as a Muslim. They want to perform. Right? What are the social skills they want to perform in order for them to be socialized. This is the thing that you need to very sensitive in terms of your objective. In terms of your objective to do SST. So when you want to conduct the SST with patients, must be individual basis. Individual basis, you cannot lump sum. You cannot generalize all the individual in your program. So certain individual need to have this type of social skill training. Uh, uh, the other individual probably need other social skill type of training. The diagnosis is helpful for selection. For example, uh, social phobia. Social phobia, you know that there is a social skill that involved for the training. Um, for example, like schizophrenia is different, different in terms of the social skill training. But there is a danger of using it because of what you cannot just make assumption with the diagnosis you have by by you know by generalize the diagnosis to the patient need. So you need to be careful. Yeah. So patients who have depression, one of the client that needs social training, client who have depressive states. So this client have tends to have low level motor and verbal activity. So you need to understand condition like major depression disorder or bipolar who at depression stage. They have a low level of motor and verbal activity. eh. Their movements are retarded and the posture droop or tense. So the posture is tense. The movements are retarded, mean they have slow movement. They have problem of slow speech. They have problem with their muscle in terms of communicate. Yeah, so this need to be considered in terms of social skill training. So their speech is slow, they are low in tone, and they are expressionless. Expression they didn't show their expression, especially schizophrenia patients. They have little eye contact, little eye contact, facial expression sad and gloomy. So when you do social skill training, don't make assumption unless you know the condition of the patient. So do, don't take for granted if they have their speech is slow, not because they want to teach social skill training in combination, for example. don't rush in terms of want to achieve the skill, because this is the nature of them. Their speech is slow, eh? their expression their expression is there's no expression or less expression, facial expression with them, and they have little eye contact. So it's you need to take into consideration of when they have these depressive states, and then their appearances. Their person looking tired, apathetic, and lacking initiative. This is the nature of them. Yeah, when they are in depressive states, feeling of guilt, unworthiness, and anxiety. Social contact avoided due to loss of interest in other people. Some of not because they don't want to, but their nature of their depression states. They want to avoid due to loss of interest in other people. So these type of cases need to have more from more positive reinforcement for this type of cases. Yeah. So when there is a anxiety states, for anxiety states of patients, they have this prolonged and anxious feeling result in increase of motor and verbal activity. So if you want to teach social skill training, especially in communication, if you doing social skill quite long, uh, eh, or quite have more endurance taking place in your social skill, they have this problem. Prolonged and anxious feelings result in increase of motor and verbal activity. So you cannot uh, have a session with demand um, of verbal activity, because their feelings in terms of anxiety is prolonged. Their movements may be sharp and uncontrolled, and posture tense. So they are easily tense. Their speech breathless, short, rapid bursts. So when talk about when you do social skill in terms of want to improve their communication skill, they easily breathless, and then they have short, rapid bursts. It doesn't mean that they don't want to participate, but you need to consider their 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 speech. So, eye contact fleeting. Fleeting is when talk about fleeting. Hang on, yeah, fleeting. Uh, the eye contact is not last long, so it's fleeting. So you need to consider when you do social skill training with them. Their expression, preoccupied and worried. So you have to bear in your mind when you conduct social skill training for them, their expression look preoccupied and worried. These so you need to consider is normal for them. This is the behavior of them when they have this anxiety state, especially anxiety neurosis, phobia, or that. So you need to calm them down and really support them and motivate them, because they are at the anxiety states. Yeah? So patients with phobic states, their experiences exaggerated and irrational fear. So when you conduct social skill with this social phobia, they have this irrational fear, and when they share their experience, they're easily exaggerated. They easily crying when they share their experience, and then they have these phobias, claustrophobia and agoraphobia. Right? These two main phobias. So when you conduct social skill, you need to understand what are their phobia, whether they are claustrophobia or agoraphobia. Yeah? And people who having this addiction of alcoholism and drug, uh, they have deficit skills that required to cope with stresses of life. So these people easily stress, and they have this issue of coping mechanism. They have a deficit skill of coping mechanism. Skills needed to resist social pressures to keep on taking them, talking them. So, so when you conduct social skill training, one of your objective is to reduce, to teach them coping mechanism, how to resist social pressures. Social pressures mean social pressures more on materialistic. For example, depend on the society. Some of the society, their materialistic social status. They look at the status of that. So you need to come up with social skill how to cope with the social pressures. Yeah, skills to make them feel less inferior and more acceptable to others. Uh, so this type of foundation, they are uh, they feel less inferior. They feel less inferior meaning that they have their ego. Right? They have their ego. They feel they are better. Right? And they want to be acceptable. They want to be acceptable to others. And there is another condition they call it behavioral problems and personality disorders. Children and adolescents who are withdrawn, unassertive behavior, aggressive, disturbed behavior. So when you conduct social skill, you will need uh, to understand this because they have behavioral problems. So you want to reduce this behavior problems, uh, withdrawn, aggressive, disturbed behavior. So when you conduct social skill, more on positive behavior rather than looking at the negative behavior. You want to create positive behavior for these children and adolescents. Leads to delinquency, imprisonment, mental illness, and psychopathic abnormal personality disorders. So you need to understand with this kind of disorder, they are very manipulative. They are psychopathic. Psychopathic is they are able to manipulate, or they can change. They can be. They can change their personality for their. They want to do something. They have something in their mind. So they have this psychopathic abnormal personality disorder. Social skill need to be relearned, especially assertive skill with less aggression. So when you conduct the personality disorders, some of the social skill need to be relearned, especially assertive skills with less aggression. Yeah? How to say no by reduce the aggression. some some of them, especially the teenagers, they have when they don't like it, what the instruction they have to follow, they will be aggressive. So you want to reduce their behavior to less aggressive. Yeah, have to you want to teach them how to be assertive. Some of them, their problem is that they easily be influenced by their peers. So your social skill, you want to uh, teach them how to be assertive, to not to follow their peers. So this is the thing that you need to consider in terms of your social skill training. So there's another condition they call epilepsy. Eh? So epilepsy is frightened by their epilepsy and other people reaction to it and then. So they have stigma. Inside, they have not the stigma. Sorry, this is more on uh, their condition. They're afraid their condition, and then this social skill training more on to educate this epilepsy condition how to accept their condition. eh? because they feel scared, scared that people react to their condition. eh? May react by adopting aggressive behavior or withdrawing from social situation. So you need to be uh, need to be understand with this situation because they can suddenly aggressive. Right? They can suddenly aggressive by they don't want or they want the way of their don't want to participate by adopting aggressive behavior, and then they have this poor behavior that may be socially inadequate, okay? And may lead to isolation and depression. Okay? So when you conduct with social skill with epilepsy patient, you need to consider their behavior, eh? their feelings, because they feel that people will react to their conditions. And then they experience epilepsy. They feel that people scared with them. Yeah? The other condition is schizophrenia. So schizophrenia, their condition is withdrawal, lack of spontaneous and relevant verbal communication, and flattening of emotion. This type of schizophrenia. So you need to be patient. So they are very slow. Right? They are very slow. The lack of spontaneous, and then the communication sometimes not relevant, and the emotion is not the emotion that you want. This is schizophrenia patients. They have lack of eye contact, posture, gesture, and facial expression. They failure to cope with everyday personal care skills such as washing and dressing, simple literacy and numeracy skills such as reading, writing, telling the time, counting money. So when you conduct social skill with this type of case, it's more on personal, personal care skill. But schizophrenia, there's a wide of range of difference between individuals. So you need to understand your patient more, whether they are lack of personal care, this probably the nature of their physical is there. Yeah? So you need to understand this schizophrenic type of patients. Yeah? So you need to do individual assessment. So when you assess your patient, You need to discover more about their past and their 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 history, their personality, and their present relationship, and what kind of enduring problem they have with various people. So, what are the things that they are lacking when they deal with their parents, with their peers, with their doctors, with the community. So, what are the things that really affect them? Yeah? Find out more about difficulties they experience in specific situations. So, what are their experience in specific situations? Situation when they want to communicate with their peers, situation when they want to communicate with their parents, they want to communicate with their immediate boss. So you need to understand what are the difficulties and what are the situations. Right? So another thing you can get information is to obtain from others, the staff, the relatives. Right? It can be done by interviews with patient and by your observation. Right? When you conduct intervention, for example, you do domestic activity, you can observe. Eh? You can observe them. What are the things that lacking with them in terms of social skill? Social skill. Then you detect, and then you note this is the thing that the difficulties of the patients and the situation that they have when they have this situation and what are the difficulties they experience. So easily you want if you want to conduct social skill must be based on the condition and their difficulties and also their situation. And then you need to records and ratings may also be made from this observation. You can record by your observation. You able to record. You note down or you do video. You recording your activity or your social skill training, and then you need to rate there. Rating is very important. You want to see the progress of the social skill of the patient. So you need to have relevant rating skill eh, when you conduct social skill training. So when you have all the relevant information, then you can come up with suitable social skill training program that can be planned to meet the patient individual needs. Yeah. So social skills, the bottom line of the social skills to help patient get what they want from others, and then how others respond to the way they act. Okay? So the most awareness and control a person has over his or social behavior, the more success he or she is likely to have in dealing with other people. Okay? So social skill is easy, something that you want from others. Okay? For example, you want to buy grocery, buy grocery. So the way you interact, you socialize, if you able to have a skill that others able to respond the act you want, that means there is a achievement. So this is the way of you want to conduct your social skill. The success of the social skill is this. Yeah, you want to get the social skill is the way we want to help the patient to get what they want from others, and others respond to the way they act. So we want to train how to act is by social skill. So they have to have behavior, social skill behavior for stable situation. For example, job interview, how to behave, how to react, how to perform their social skill in terms of job interview, in terms of making new friends, engage in relationship. Eh? Don't only focus on the job and making new friends, but can be also engage in a relationship. Eh? Engage in positive, engage in sincere relationship. Right? Also can be you need a stable behavior. When they're working also, when they play sports, when they work, how to behave professionally. Some of these, even at the university also, some of the lecturers have a social skill problem in terms of professional relationship. They are unable to engage themselves, to socialize with their peers, their other their peers while they're working also. They have a problem in the social skill, we will affect them. Even you play like me, I play golf with friends. I have to have a social skill. If not, I'm unable to sustain my relationship with others, with my mate. Yeah. So social skill is about behavior, stable behavior. So when talk about social skill, there is a communication. There is a communication. That is a non-verbal and verbal communication. Okay? So Birds Wicksell, 1970. So he said about out of 24-hour period of leisure time, we speak only about 10 to 11 minutes. If you doing your leisure, okay? Only 10 to 10 minutes. Okay? So you need to have communication, right? Either verbal or non-verbal. But when some of us only can have a non-verbal communication, but when talk about verbal, this study by Bert Bissell, he said we speak only about 10 to 10 minutes. So if you want to know about your how long you speak, you can rate in day how much you speak. Like me, I have to have verbal communication a lot. Yeah. Teaching you all SBL, training, lab. I have to engage you all. Lot of communication depends on the nature of the job. Yeah. And then they said, verbally, women are better liars. Verbal women who talk, they can talk. They have hidden talks. They are able to lie and when they speak. Non-verbally, neither sex is able to lie. So, if you want to we want to detect uh, people is lie or not is by their non-verbal communication, their facial expression, their posture. We know that the people is lying. For example, like detective, uh, eh, uh, police kan, when they investigate and they interview. You can lie verbally, but you cannot lie using your body language. Police can detect. Usually custom dekat airport. Dia nak tangkap seorang tu, dia tak payah interview orang tu. Dia tengok saja dia punya body language dia. Dia punya posture dan sebagainya, dia tahu. These people having something hidden in their bag. That's why they are smart, custom, police, in terms of detect lie by looking at their non-verbal communication. And it is very important to, in terms of non-verbal communication, to reinforce, replace, compliment, emphasize, regulate. So when you communicate with your patient, you need to have this. You need to reinforce, you need to replace, compliment, emphasize, regulate. This is the flow of communication. So when you have non-verbal communication with your children also, you need to have this flow of communication. So non-verbal communication, Agi et al. 1981 on main forms of non-verbal communication. He said that your bodily contact, some when the person you see at the politician, so how they communicate. Some of them don't need to have communication. They just a bodily contact. Salam saja, tepuk badan saja. Dah nampak kan dia punya friendliness or that kan. Proximity, your punya distance with the person. So if you like to have distance in terms of your proximity, you want to don't want to you want to standing away from your person you want to communicate. It shows that you are not feel comfortable. If your proximity is very near, shows that you are very friendly. So orientation, postures, gestures and body movements, facial expression, eye contact, appearance, paralanguage, the non-lexical components of communication by speech. For example, your tone, pitching, speed of speaking, hesitation noises, gesture, facial expression. This is called paralanguage. Paralanguage. Before you talk, you have your intonation, your pitch during your communication. But there's not a word, but there's a they call it the non-lexical component of communication by speech. No need to have a word, but the way that your tone, your pitching, speed of speaking, hesitation noise, gesture, they call it paralanguage, and it's considered as non-verbal communication. Bodily contact, So research shown that touch and close attachment at early stage, and especially to the mother, are crucial to subsequent healthy behavioral development. So, you're able to touch and sit closely, shows that you are good in non-verbal communication. As the child grows up, term and concept is used between friends of the same opposite sex. So, so depends on the development of the children. When they sit close together. They have a bodily contact with each other. So for children, for mother who have show their touching and attachment, bodily contact with their children, this is a healthy behavior development. Yeah? Adult, certain taboos on both the amount and kind of body contact which is socially acceptable in given situation. So depend also in our society and depend on the society, yeah, and their community and their status. And like in our Muslim community, male and female, you are unable to have bodily contact. Is their belief. Eh? So depend on the belief and also community norm. Yeah? Right now we have new norm, physical distancing due to the COVID-19. Yeah? Cultural differences. Paris, people will touch each other 120 times in 1 hour. In Paris, yeah? Not right now lah. New norm, different. Last time, Paris, they touch each other 120 times. Compared to Japanese, I think Japan people, they hardly touch each other. In London, 1 hour no touching at all. So 1 hour, you know, London, their norms, they don't touch at all. Shaking hands and kissing when meeting, taking leave. So, and so depend on the community and the culture. For example, US, Australia, you need to shake hands and kissing when meeting, and then professional touch in certain ways. So depend on the culture and then depend on the profession. To produce of intimacy and on a less intense level to show caring and concern, to give encouragement and support. So when in a social skill training, yeah, some of your cases problem of bodily contact. So depend on the culture and the situation, you need to teach them in social skill training. Proximity has to do with the position in terms of distance. So intimate zone 0 to 18 inches. Kalau boyfriend, girlfriend yang betul-betul dah berkasih-kasihan ni, biasalah 0 to 18 inches. Is considered lovers. Personal zone 18 inches to 14 feet, 4 feet. Kalau friends, kalau dekat-dekat peluk-peluk tu, ada isu proximity lah. Some of the cases where there are real problem, for example, like child psychiatry, they don't understand this personal zone. So you need to do social skill in terms of to have proximity, personal zone. And if you do social consultative zone, the proximity is between 4 feet to 12 feet. This is more on professional relationship. So when you do consultation, your distance with your client is about 4 to 12 feet. It's more on professional relationship. In public zone, 12 feet applies to royalty, public speakers macam politician or that, they have their public zone, macam apa, raja, kalau raja berjalan macam mana, so 12 kaki. So the position we take up in the dyadic one-to-one or group more than two will have effect on the kind of relationship we hope to achieve. So in your social skill training, so you need to understand the proximity, the where you want to position your group member. This is very important. There's an effect. There is effect of what type of what kind of relationship that we hope to achieve. Okay? Orientation is linked with proximity and has to do with the angle of the whole body when relating to another and also sitting arrangement. Side by side cooperation, face to face competitive. Okay? So when you want to do group social skill depend on the what you want to achieve. You want to have cooperation, you sit side by side, face to face competitive. Conversation seems to be most facilitated when chest person are at 90 degrees. So when talk about therapist with patient, so the position also very important. You want to have cooperation, but when talk about competitive, what you going to have the orientation of the group members also very important. Posture also, there is three main categories: standing, sitting, or squatting, and lying down. Eh? In terms of posture, also very important. When both are seated, interaction is more prolonged and relaxed. If one is seated and one is standing, threatening. Intense emotions such as anxiety, depression can be picked up through a person's posture or body language. So if you want to conduct, for example, a group social skill training, so you have to conduct in sitting because this interaction is more prolonged and relaxed. But if you sit, the other person is standing, is threatening type of interaction. Okay? So you can pick up posture dia. Kalau people yang tense ni, dia tak boleh duduk. Duduk pun kaki bersilang. Kaki bersilang nampak situ. Posture also play important role on non-communication. And then gestures and body movement. Friedman and Hoffman, 1967, distinguish gestures that are linked with speech and are directed towards object or event as aid to communication, and gestures which are oriented towards self and are more to do with release of tension. Gestures also and body movement also important. So when you talk with your body movement, actually you want to release tension. Kalau you tengok India, bangsa India bercakap compare dengan Chinese. Chinese bila bercakap dia tak banyak guna gestures daripada India. India banyak guna tangan. So probably the way dia speak tu menunjukkan dia ada dalam keadaan tension or not. Facial expression, when you you see your patient, facial expression they can portray 7 main emotions: happiness, fear, sadness, anger, surprise, disgust, contempt, and interest. So during social skill training, you have to train your patient how to portray their emotion by facial expression. While interview, takkan you nak tunjuk muka disgust, contempt. We should feel tunjuk muka yang happy, happy, confident. Eyes and mouth are two regions of the face which can express the most emotion. Although the eyebrows, lips and tongues are also you tengok mulut dan mata dia. They say two regions ni, yang dapat express the most emotion. So when when patient, when you want to teach social skill training, you have to also to teach the special facial expression while they interview, while they establish intimate relationship. So so kena ada facial expression. Eye contact, eye contact, eye contact or mutual gaze almost invariable initiate some kind of interaction. After contact is made, the movement of the eye control and synchronize the concept. In diadic encounter, the listener looks at speakers twice as much and where there is a stronger emotional content in the interaction. Whether loving or angry, the eye contact will also be more intense. So, eye contact. Some of your clients, they have problem of eye contact. So you need to teach them how to have eye contact. You can show your emotional, whether you are loving or angry. Your appearance, physical appearance include face, hair, body shape, and clothes. Also, you need to teach your patient in terms of the appearance, facial expression, dye hair, social grouping. The depends on the group also. Right? Clothes. This is the way of you want to train also your client in terms of interview how the appearance they should have, kan? Kena pakai tie, kena smart, kena sikap bersih, kena masuk dalam baju. Ini pun kena train, social skill training for your client. Paralanguage. Paralinguistic is commonly referred to as that which left after subtracting the verbal content from speech. It is the vocal expression that includes the tone, pitch, sound, level and speed of vocal expression. So you need to train your patient using paralanguage, vocal expression. Dia punya tone, dia punya pitch, speed, masa interview, kan? Masa interview, macam mana you punya tone, you punya pitching of sound. So dia lebih kepada you nak emphasize when you communicate your spoken word. So you need to teach your client in terms of paralanguage. The accent, hesitation, sighing, screaming, laughing, crying, whistling, all that. This is a paralanguage. So in terms of that one, before that is non-verbal communication. So this one is verbal communication. Travel et al. 1978. There are 8 different kinds of verbal communication or utterances. Instruction and direction, questions, comment, suggestion, information, informal chat or gossip, performative utterances, social routines, expressive emotion or attitudes, latent message. So this is a form of verbal communication. So some of your clients have problem to communicate these 8 different kinds of verbal communication. So when you conduct social skill training, there is 4 groups. One group, for example, your objective is to have self-expression, right? And then the other, enhanced skill. So you want to, one group, for example, you want to their problem with they have problem of self-expression. You want to conduct self-expression, and then the other, enhanced skill, communication, non-verbal communication, and then assertive skill. Assertive skill, how to say no, how to, in a proper way, not aggressive way, and their tone, all that. Then communication skill, communication skill to your employer, while with your friend, boyfriend, communicate skill with your father, parents, all that. There is 4 group of social skill training. So what is self-expression? Self-expression is more on how to express their feeling, express stating, and they want to communicate their feelings, communicate their opinion, how to communicate positive things about oneself, how to connect one's belief and values. This is more on self-expression. So depend on your patient difficulty, depend on the situations. So, for example, one session you want to have self-expression, want to express tak puas hati macam mana, marah, getting angry, you want to voice out something, but you want to you want to you want to state positive things about yourself. So these call it self-expression, social skill or self-expression. This one, enhancing skill. You want to they have a skill, but you want to enhance their skill. For example, giving compliments, smiling, expressing interest, giving support and encouragement. So these need an enhanced skill. If not, the person that you want to express your interest will not give to you. Right? So they want to enhance the skill. These 4 type of enhanced skill: giving compliment, smiling, express interest, giving support, encouragement. So they call it enhanced skill. Assertive skill, making requests. So if you want to request something, you need to be assertive. Some, for example, like your lecturer, giving you a lot of assignment, and you are unable to cope. How are you going to making a request? So you must have assertive skill to demand something in a proper way lah. You want something, you want request, you must have a good combination of requesting, and then questioning another's behavior. It's very important also. For example, like your peers, your roommate have inappropriate behavior. So how you question without hurting their feelings? So this is, they call it assertive skill. Setting limit, not sitting, setting limit on another's aggressiveness. So as a therapy for you, for example, like you want to set limit, you want to, for example, like you want to you want to request, there is a limit on another's aggressiveness. For example, like they have competition. Contoh, for example, apa ni, perlawanan boxing kan, you tengok perlawanan boxing tinju macam mana referee dia set the limits kan, so dia kena firm communication dia kena firm dia mesti ada assertive skill. Kalau dia lembik dan sebagainya, macam mana orang nak faham kan, how the other person we follow the instruction kan. So must have assertive skill. Communication skill, controlling the tone and quality of one's voice, articulating words clearly, choosing the proper words. So this is very important when you communicate. When you communicate, your word must be clear. You must choose proper words. Kalau tidak, orang tu akan marah you. Tone you, your punya quality of one's voice must be clear dan sebagainya. This is one communication skill. So when talk about social skill session, there is 4 phases. The first one is motivation. This is the first part. So first part is to motivate them why they need this session, and then you need to demonstrate, and then they have to practice. Then the last one, you have to give feedback to them whether they achieve or they need another training. You need to give feedback. So 4 phases. So motivation is you identify the behavior to be learned and explain why it is important. At the beginning, you need to identify this is the behavior you want to be learned, to make them learn, understand why it is very important. Therapist should give example of the desired behavior and discuss why it is relevant to the person goal. Contoh, you nak buat assertive skill, for example. Why you nak ajar dia seorang yang assertive? Apa relevannya kan? So this is the first phase. And if the person can state reason for it's important, so you semasa you motivate them, educate them, then you have to ask them. Kalau dia faham sebab dia dan dia punya kepentingan, the importance, then it will be good. Motivation. Important points, not only learning the appropriate behavior, but learning to perceive when they are appropriate. Not only learning the appropriate behavior, but learning to perceive when and where they are appropriate. So when you do this social skill training, not only learning, but also how to apply it, where the thing appropriate, where they have to notice when and where to practice it. So this is very important. Then the second phase is to demonstrate. Demonstrate shows how the behavior is performed, and if you have shows them, they have practiced it, then you buat role play. Then you buat role play. If good, you dah filem lakonan apa yang dibuat oleh klien yang lampau, dia dah buat, then they want to practice it. They must patient watch and observe, then practice. The third phase is practice. Can be structured to improve learning. One way is to ask the person to rehearse desired behavior by talking through. This can reduce anxiety before the actual perform. So kalau you nak practice, kena ada structured lah. Ini kita practice communication skill, Macam ini caranya untuk bercakap. Then sebelum dia practice tu, dia buat tu, buat rehearsal lah. Then you comment. Okay, ini bagus, boleh improve lagi. This can reduce anxiety before the actual performance. So at the end of your session, you must summarize what the person has learned. They make them realize they have learned something. You should provide immediate feedback at that time, at your session. Right? At the end, you must give feedback. Okay, this is the thing about social skill training. I like this thing that actually this one. Social skill, actually the outcome is, the bottom line is that help you get what you want from others, and then the others to respond to the way you act. So is the train us to get what we want from others, and others to respond to the way we act. This is a social skill. I hope that you are able to grasp this lecture. And there is a lot of studies. There is a lot of studies. The effectiveness of social skill. I will highlight to you. I will show you. Okay. Okay, you can read at your notes. Your notes. I will put in the folder. Folder. So one of the article regarding the effectiveness of social skill training groups for individuals with autism spectrum disorder. This more autism, there is a lack of eye contact, communication skill. This person easily get anxious. So they need to have a social skill training. So this is the review. So this article review 20 years studies that had used group-based social skill training. So 20 years back studies that use social skill to improve the social skill of adults or adolescents with ASD. 13 studies were identified, and group-based social skill training was generally effective. Group-based social skill training was generally effective at improving social skill, with some study observing transfer effects to improvement in wider psychological well-being. Some study when they found that there is an effect, dia punya psychological well-being. So this is the study. Social skill training memang dapat improve ASD in terms of their social skill and also their well-being, their psychological well-being. Also, there is a study effect of social skill training on individuals with schizophrenia. There is a study with the individual of schizophrenia. So in this, there's a lot of study. You can follow up. You can read this article in terms of social skill training. The effects, the effects using social skill training. Eh? From this study, you can see the result. This is more on uh, done by different study. Different study. For example, this RCT, randomized clinical trial by Sam Pearson, examined the effect of work-related SST with and without follow-up support on the ability of individuals with schizophrenia to obtain and maintain employment. The study resulted in significant funding to support work-related SST with follow-up support over work without follow support and standard care. So a lot of study been done with schizophrenia. You can read this article, very nice article. Then they summarize their findings. And this study on the effectiveness of social skill training on reducing negative symptoms of chronic schizophrenia. You will see in this study, you will read this very nice article. I highlight to you. There is this they do with the comparison group, comparison group. Result from the study showed there is significant difference between experimental and control groups after training social skill for improvement. The level of significance is below 0.05. Result shows that social skill training can affect reduction of negative symptoms. So this done at Iran. Iran, they do compare experimental group. They do it at 8 sessions. 8 sessions. And they found that there is an improvement of the social skill training with the schizophrenia having negative symptoms. This one, meta-analysis. Meta-analysis, as you all know, is a gold standard. Gold standard level 1. So this is more on they analyze the quantitative result of the studies that fulfill the criteria. They found that social skill training demonstrate a magnitude of effect of negative symptoms similar to those commonly reported for cognitive behavioral therapy for positive symptoms. Although unlike CBT, SST is not routinely recommended in treatment guideline for psychological intervention. SST may have potential for wider implementation. Further stringent effectiveness research alongside wider pilot implementation of SST in community mental health term is warranted. So dia sama juga macam cognitive behavior. Tapi tak recommended. Tak recommended by the psychological. Tak routinely recommended. Orang tak banyak guna. Tapi dia very effective. Very effective. Social skill training for psychosis. Psychosis can be schizophrenia, bipolar, major depression disorder, semua boleh digunakan. Okey, okey, sampai di sini saja ceramah saya untuk hari ini. So this is about social skill training for psychiatric patients. Okey, kita jumpa lagi sesi akan datang. Assalamualaikum warahmatullahi wabarakatuh.